Okay, in the last video we had a look at some primary care kit. This video we're going to go through the first responder bag. This is for a acutely sick or deteriorating patient. Let's go through each pocket one at a time. See what's in there. So first of all, in this outside pocket we have basic diagnostic kit. This includes cap glucose, a stethoscope, thermometer, peak flow meter. We have a pen torch. It's a really simple diagnostic equipment. Moving up to this pocket, we've got some basic dressings, some wound care, bandages, that kind of thing. And then again on the outside here in this zip, simple stuff like hand gel, simple analgesia, and some gloves. That's all there close to hand. And for space reasons, on this side we've got our Prometheus splint, we've got a SAM splint on that side. On this side here we have our major hemorrhage, so we've got loads of hemostatic dressings, some combat tourniquets, all in there. Then everything else is on the inside of the bag, so let's open her up. Okay, once we've opened everything out we can see where everything is. So here we've got some bottled oxygen. This would give about 20 minutes worth of oxygen on high flow. In here is all our IV stuff. Open this out. So we've got cannulas, sharp spin, we've got tegaderms, we've got giving sets, and we've got fluids, all in one place, in one bag there. Then we have a pelvic splint, pelvic binder. We have some vacuum splints, and we've got a rigid collar. I don't think we'd use that. And here is our manual suction device. And moving on to this side is all airway and breathing. So we've got airway adjuncts, so Goodell's, nasopharyngeals. Here we've got some oxygen masks and tubing. And then in this side here we've got more advanced airway stuff. So we've got eye gels, we've got the bougie and some basic laryngoscopes if we needed that. So there you go, that is just a quick rundown of the makeup of an emergency first responder kit that you might use in a wilderness setting. This configuration's not bad, everything has its place. It's really important to be familiar with your kit and know where things are. Personally, I prefer a more modular type system where you can get different modules out, the right module for what you need at a given moment. But this isn't a bad way of doing things.